this loads up. Hi everyone, I am Dr. Rashmi. I am the Senior Thyroid Surgeon here at the Hospital for Endocrine Surgery and the Director of Thyroid Surgical Services here. So today we're doing a Facebook Live session where I'm going to answer thyroid questions about thyroid surgery, thyroid nodules, thyroid cancer, really anything that you guys are interested in talking about. Just a little bit about our hospital. Our hospital is really one of a kind. It's a specialty hospital where all we do is perform endocrine surgery. So we have thyroid surgeons, parathyroid surgeons, and adrenal surgeons, and they specifically only do that operation, which is very unique. It's unlike any other hospital in the country. We're the highest volume thyroid surgery center in the country with the highest cure rates and the lowest complication rates. So I'm super excited to be here and answer your questions. I've done a YouTube live video or a YouTube live session, so we just wanted to do a Facebook live session to get a different audience. So any questions, just type them in underneath the comments and I will try to get to as many of them as I can, or you can post them afterwards and I'll get to them in the next session that I do. So let's get started. So the first question is, how would I know if I had a thyroid nodule? So this is a great question. There are different ways to know. The first way is it's found incidentally, meaning that you had no idea that you had it, and it's found on another test that you have performed. Some people have tests of the carotid arteries, a carotid artery ultrasound, and a thyroid nodule is picked up, or they get a scan for neck pain, an MRI, something like that, and a nodule is picked up. So that's an incidental way to find your thyroid nodule. And then if it's suspicious, you can get further workup. The other way to know that you have a thyroid nodule is, a lot of women, they'll be putting on lotion on their neck, or they're feeling their neck, they're looking in the mirror, they see a lump, something like that. If you feel a lump in your neck area, or if you see a lump in your neck area, that is a kind of a red flag that you may have a thyroid nodule, or maybe even an enlarged lymph node that may be related to thyroid cancer. So really the next step is to see your primary care doctor, get an ultrasound done to see what this lump is that you're seeing or feeling. The third way to know if you have a thyroid nodule is if you're actually having symptoms. So it's what we call compressive symptoms. These compressive symptoms are trouble swallowing. You kind of feel like you need increased effort when you swallow. Or you need to drink some more water when you're eating to get the food down, or you have a chronic cough when you're not sick, or you constantly feel like you have to clear your throat, that there's just like something there, a tickle almost, that you can't get rid of. Or when you lay down, if you feel tightness there when you lay down. So these are all typical compressive symptoms. If you feel any of those, then you should ask again your primary care doctor, can I get an ultrasound? I may have a thyroid nodule. So those are the main ways that people find out that they have a nodule. Okay, next question. My grandmother died of thyroid cancer. Does this mean I am more likely to get it? Should I take additional steps to be screened more often? So this is a good question. A lot of people ask, if a family member has thyroid cancer, should everyone in the family get screened for thyroid cancer? And that's really not the case. There are certain thyroid cancers that are hereditary and are genetic, and those specific thyroid cancers, specifically medullary thyroid cancers, there's a genetic mutation where if you're positive, then absolutely your immediate family members need to be genetically tested. Papillary thyroid cancers, it's very rare for it to run through generations. It certainly does happen. We have family cohorts here at the center where papillary thyroid cancer has run through generations, and those specific families should get screened more often. But if your grandmother had it, it does not mean that you're more likely to get it, and you do not need to take any additional steps. You can be a little bit more aware, of what your neck feels like. I'm a big proponent of doing self-checks of your neck. There's actually a video of me doing it on our website. You can check it out. But basically, you're just feeling your neck, just to be aware of your body, see if you have any thyroid nodules. So that's something you can do, but I wouldn't be too aggressive to getting more scans because a distant family member had thyroid cancer. Okay, next question. Is it okay to use natural remedies and supplements for thyroid issues? I seem to feel better when I use them. So this is a very loaded question. I absolutely do think that there are supplements that you can take and that make you feel better for if you have thyroid issues. Some of those vitamins and supplements are zinc, vitamin A, vitamin D, magnesium. So there are certain vitamins and supplements that promote thyroid health and promote thyroid function. And if you take them and they make you feel better, then absolutely, you should continue taking them. If you have Hashimoto's disease, gluten-free diet is the best diet for you. That's a great thyroid diet if you have thyroiditis. So the answer to that question is yes, if you're dealing with thyroid functional issues. If you have a thyroid goiter and you are looking for natural remedies to rub on your neck to decrease the goiter, to make the size go down, that is not working. Do not waste your time doing that. If you have thyroid cancer, do not do natural remedies to get rid of your cancer. That is not going to work. I have patients that have gone to Mexico because there are places there that give IV therapy, hyperbaric oxygen, IV vitamins, and they claim that they're going to cure the thyroid cancer. It doesn't happen. All it's doing is prolonging your eventual surgery that you need and possible spread of this thyroid cancer and likely spread of the thyroid cancer if you're not being proactive about it. So natural remedies for thyroid function, yes. For thyroid goiters or thyroid cancer, no. Next question. I was diagnosed with Hashimoto's before being diagnosed with thyroid cancer. What will happen to the Hashimoto's after I treat the thyroid cancer? So this is a great question. We deal with this a lot here at the center. Patients come in and they have both going on. So there are different treatments for thyroid cancer. Just because you have thyroid cancer does not mean that your whole thyroid needs to be removed. Here at the Hospital for Endocrine Surgery, we can potentially cure thyroid cancer by just taking out half your thyroid. We do intraoperative pathology to make sure that that's the best operation for you, but that is what we prefer to do because you're saving natural thyroid hormone and natural thyroid tissue, and you're getting the same cure rate. So if you have Hashimoto's and thyroid cancer, if you are doing well with your Hashimoto's, meaning you're either not on medication or you're feeling well on medication, then we're going to want to try to save that half of your thyroid, assuming that's what you want to do as well. If we save that half of your thyroid, you will still have Hashimoto's, but the majority of Hashimoto's patients do great on thyroid medication. For those patients that do not do well on thyroid medication and their quality of life is really dramatically affected by their Hashimoto's, then we would take out your whole thyroid gland. So if we took out your whole thyroid gland for multifocal papillary thyroid cancer, meaning you have thyroid cancer throughout your thyroid, or if we took it out for Hashimoto's and thyroid cancer, the Hashimoto's and the thyroid cancer would be cured and would be gone. So if the whole thyroid is the short answer, if the whole thyroid is removed, your Hashimoto's is gone, your thyroid cancer is gone. If half the thyroid is removed, your Hashimoto's will still be there, but we're only doing that if you're doing well with your Hashimoto's. So hopefully that answers that question. Next one. Why is thyroid cancer more common in women? Another great question. So yeah, thyroid cancer certainly affects women more than men. It affects women 3 to 4 times more likely than men. We do not know why definitively. However, we think that estrogen is a causative link because it happens more in women than men. But there's been no scientific study yet to say that increased estrogen causes thyroid cancer. Also, women, they tend to take better care of themselves health-wise and tend to go to the doctor more, tend to get more scans. So they're more likely to catch an incidental nodule like we were talking about in the beginning of the session. So women tend to be more proactive. They tend to find their nodules more. Also, OBGYNs are much more prone to do a thyroid neck exam during a physical exam than other physicians, so another reason why women are finding it more. So I think there is a scientific component, but also just another component that women are more aware of their health. Next question. Why do so many surgeons go straight to a sternotomy for a large goiter? Well, this question I love because I get it all the time, considering that I am the goiter guru. So I think that other surgeons go straight to a sternotomy because they don't feel comfortable doing it any other way. And you know, the more room that you have, the easier this is to get out. So if you are not highly experienced, highly skilled, and comfortable with these substernal goiters, then you're going to do whatever is going to make it easier for you. So like I say on my YouTube channel, you know, if someone tells you that you need a sternotomy, it is usually not the case. So if that happens, then you need to contact me at thyroidcancer.com. I'll review your images and I'll let you know if I'll be able to do it or not. But my main point is, do not go with the first surgeon that tells you to get a sternotomy. Okay, next one. Approximately how many thyroid cancer surgeries would a surgeon need to do per year in order for you to feel comfortable with them performing surgery on your spouse? This is a great question. Well, I personally, for my husband, I would want the highest volume, most experienced surgeon that I could find for them to do his thyroid surgery. So what does that mean? So if you look in the literature, if you look at the American Association of Endocrine Surgeons, the American Thyroid Association, they consider an expert anyone that does more than 100 thyroid surgeries a year. You know, I've been doing this for close to 15 years. I think that 100 thyroid surgeries is not nearly enough. I would not let someone who just does 100 operate on my spouse. I would say, you know, on the order of at least 350 to 450 a year. Then that would be an expert. I do 600 thyroid surgeries a year, so you know, I would want that for my spouse. So you just really want to make sure that they're highly skilled and highly experienced in that specific surgery. Next one. What type of testing should I have done prior to thyroid surgery? A CT scan, an MRI, PET scan, etc. Okay, so this is very variable. It just depends on what you have going on in your thyroid. If you just have a simple thyroid nodule that is indeterminate, meaning we don't know what's going on, you really don't need anything else done prior to getting here. We do a full diagnostic evaluation when you get here to our center. We do a full ultrasound that looks at your thyroid, all the lymph nodes in your neck. We can do a biopsy here as well if we need to. We also can do a CT scan right away if we need to. So if it's just an indeterminate nodule, you don't need anything done. Even if it's thyroid cancer that was newly diagnosed, we can do everything here. You don't need to get anything done prior. If we're talking about a recurrent thyroid cancer or a more aggressive thyroid cancer, we may want you to get a PET scan before coming here. If you're calling me and you are, you know, on the West Coast or you live out of state and someone told you that you have a substernal goiter, and all you have is, you know, an ultrasound where they can't see anything down into your chest, I'm going to want you to get a CT scan so I can see the extent of the goiter before you travel across the country to see me. So it really depends on what you have. Basically, if it's you know, not that complicated, you really don't need anything before you get here. We can do everything here. If it's a little bit more of a complicated thyroid cancer or a goiter surgery, you may need some preoperative CT scan or PET scan before coming here. But we'll talk about it. You know, you're always going to have access to the surgeons before coming here, so we'll let you know exactly what you need. Okay. Can you talk a little bit about your screening program? I am local to Tampa and curious how you choose where to host the events. Also curious about the findings. So basically this question is alluding to or asking about my thyroid screening program. So for now 2 years, I've been doing a free thyroid screening program in the Tampa Bay area. And the reason why I'm doing it is because I think that every woman at the age of 35 should have a screening thyroid ultrasound. Just like women at 40 have to get a mammogram, and there's colonoscopies that need to be done for screening, and there's screening tests for everything, but there's no screening for thyroid cancer. I am a huge proponent of this, so I've been doing it. The Hospital for Endocrine Surgery has been doing it in the Tampa Bay area for free for certain businesses. So basically what the program is that I come out with 2 of our world-class ultrasound technologists, and we do free thyroid screenings. They get screened, and then I talk to you about your results, and I tell you what the next steps are. So that's basically what it is. So businesses have basically found us because they became aware of what I've been doing. There is a link on our website at thyroidcancer.com. So if you are a local business and you want to have your staff or a certain community screened, I'm happy to do it. You would just contact Julie at our office, and there's a link on our website. I need at least 40 people to attend, 40 women to attend, because otherwise it just doesn't make sense for us to bring all of our people out there. So the findings have been pretty astonishing. To date, I have screened almost 600 women with no history of thyroid cancer, and 15% of them have suspicious nodules, enough so that they require a biopsy and even surgery, and we found thyroid cancer and cured them that they have had no idea that they even had a thyroid nodule, let alone thyroid cancer. So we're going to keep doing this in the Tampa area. So if you want this to be done, you can just find us on our website at thyroidcancer.com. Okay, what is the recovery after thyroidectomy? Is it painful? So the recovery of thyroidectomy is actually pretty quick. It is a major surgery. People also ask that, is this a minor surgery? So we always like to say there's no minor surgery that's being done on you, right? If it's being done on you, it's major. But even though we do this through a small incision, it is a major surgery. There's a lot of structures. It's inside your neck that are very important, obviously. It's a very delicate surgery. So the nerves to your vocal cords, the parathyroid glands, trachea, esophagus, carotid arteries, all of that is in play. So it is a major surgery, but the recovery is really not that bad. I expect you to be, so I'll do a lobectomy, half your thyroid in 30 minutes. I'll take out a total thyroid in about an hour. So, when you're getting this done by experts, it's not a long operation. It is general anesthesia, you're completely asleep. But yeah, I expect you to wake up, be talking, walking, caring for yourself, eating whatever you want that afternoon. There's no restrictions on diet. After 48 hours, you can do light cardio, walking, jogging, biking, things like that. The only long-term restriction is just no heavy lifting for 3 weeks, or really strenuous activities for 3 weeks, but you're really back to your normal self pretty quickly. You can go back to work after, I usually say a week. That is usually a bit of an overkill. People usually go back after about, 4 days or so. But yeah, people are very surprised at how well they feel. As far as is it painful? So the majority of our patients only use over-the-counter medications. So the first thing you'll remember when you wake up from surgery is that we put an ice pack on your neck. Just like football players, when they get off the field, they go into an ice bath. We put an ice pack on you when you wake up from surgery for swelling and a kind of inflammation. So you'll have an ice pack on your neck for 3 days continuously. When you need a break, you take it off, but then when you're ready, you put it back on, but you use that for 3 days. You use anti-inflammatories like Advil, ibuprofen, Aleve, one of those, whichever you prefer, around the clock for 3 days, and then in between those doses, if you have pain, Tylenol or extra strength Tylenol. So really between the ice, Advil, and Tylenol, you shouldn't need anything else. So it's not that painful. The most common complaint is really just a sore throat, and that lasts for 2 or 3 days. Next question. Do I need a referral to be seen at your center? So no, you don't. You do not need a referral. I think there are some insurance companies that just your insurance company, you may require a referral just if you have specific insurance companies, but our center itself does not require a referral. If you find us online, your doctor knows about us, your friend knows about us, your family member knows about us, just go online, go to thyroidcancer.com. There's a tab there that says become a new patient. I actually have a video on my YouTube channel at Goiter Guru to walk you through exactly how to become a patient. It's super easy. You click tabs, you fill out a form, and then one of the surgeons will actually call you and go over your records with you and your history with you and tell you what the next steps are. So you're actually going to be talking to one of the thyroid surgeons when you fill out a form at our center. But no, you don't need a referral. Okay, next question. My TSH is high and it has been increasing. Does this mean I should be tested for a goiter? So let's just break this down a little bit. So if your TSH is high, that means that you actually have low thyroid function. That means that you're actually hypothyroid. So there's an inverse relationship there. So having thyroid nodules or having a goiter does not mean that your thyroid function is going to be abnormal. So thyroid function and thyroid nodules, thyroid function and thyroid cancer, thyroid function and goiters do not go hand in hand. They can happen at the same time, they can happen independently of each other. So one does not mean the other. Sometimes, or endocrinologists or even primary care doctors, if your thyroid function is off, they will get an ultrasound just to see what's going on, because a TSH level being high means, like I said, you're hypothyroid. The most common reason to be hypothyroid is if you have Hashimoto's. So if your thyroid function is off, you'll likely get an ultrasound at some point, and that may diagnose you with a nodule or a multinodular goiter, but it does not mean that you automatically have a goiter just because you're hypothyroid. You should be looking for symptoms or feel around in your neck, and that would be more indicative of you having a goiter. So next question. Can thyroid cancer spread anywhere other than the lymph nodes? How do you ensure that that has not happened? So yes, thyroid cancer can spread other places than lymph nodes. It is much more rare for it to spread outside of the neck area, outside the lymph nodes, but it can happen. So the first thing that we do, at our centers, like I said, is we do our full thyroid ultrasound. So not only are we looking at your thyroid, but we're looking at the most common places for thyroid cancer to spread, which are to the lymph nodes in the neck. If your thyroid cancer has not spread, and I mean significantly spread to the sides of the neck, it's very, very low likelihood that this is going to spread anywhere else. So papillary cancer can spread to lung, it can spread to bones, but we know that for the most part when we see you and we see your imaging. It's very apparent those patients that need to be tested further to see if this has spread outside of the neck area. So if you have significant lymph node disease in the sides of your neck, then we would get further testing, whether that's a CT scan or PET scan, to see if the cancer has spread elsewhere. So being experts, we know when to test certain people, and we will do so if needed. But the standard thyroid cancer patient will be cured with the thyroid surgery and possibly radioactive iodine if it's needed. That's another thing, radioactive iodine, if it's necessary, meaning that you did have significant lymph node involvement, we've cured you with the surgery, but you just need that adjunctive treatment of radioactive iodine. Radioactive iodine, before you get the treatment, it is a full body scan. So that's another way that you're being tested to see if thyroid cancer has spread outside your body. We would let you know if you need to get tested further, but that's usually not the case. Okay, next one. Are larger nodules more likely to be cancerous? So we talk about this a lot when we see patients because my goiter patients, they'll come in, they'll have these large goiters, and just because it's big does not mean that it is a thyroid cancer. Surprisingly or interestingly, benign nodules actually grow faster than malignant ones. So larger nodules are not more likely to be cancerous. There is the most aggressive type of thyroid cancer that, of course, everyone, when you go down that Google rabbit hole, it gets your attention. Anaplastic thyroid cancer. That anaplastic thyroid cancer is so rare. Definitely do not go there right away. But an anaplastic thyroid cancer, yes, that grows quick, that grows fast. This is a rapidly progressing mass. That gives you symptoms right away of hoarseness, difficulty swallowing, things like that. But that should not be the first thing that you think about. Larger nodules are, not more likely to be benign, but they need to be evaluated, by an expert with an ultrasound and biopsy to determine what needs to be done. And even if it is a large nodule or if it is a large cancer, we'll still be able to cure it. Okay. Half of my thyroid was removed in 2020. My TSH and T4 are both low now. Would this indicate a problem? So no, this is just this goes back to the idea of thyroid function is not indicative of a thyroid cancer. So TSH, T4 you need to get a full thyroid panel. You need to get your T3 taken, your T4, your TSH, your thyroglobulin antibodies. So it needs to be looked at as a full picture to see exactly what's going on. You just may need, thyroid hormone medication. You may need combination therapy. You may need a thyroid blocker in addition to thyroid medication. So really, you need a good endocrinologist who's really going to look at you as a whole. Look at all of your thyroid function and put you on the right medication that you need. That is what I would suggest should be your next step, is to get a really good endocrinologist who knows thyroid function. Okay. I have 2 lymph nodes that are not suspicious right now, but are 5 millimeters and 6 millimeters. How often should I get them checked? I am nervous about recurrent cancer. So I'm assuming that this patient obviously had thyroid cancer and there's lymph nodes somewhere in the neck that are measuring at 5 millimeters and 6 millimeters. So things that are need to be looked at for recurrent thyroid cancer, like I just mentioned, thyroglobulin is really your best tumor marker. Assuming that you don't have elevated thyroglobulin antibodies, then you can really use thyroglobulin as a tumor marker. And so if your thyroglobulin levels are really 0 or undetectable, or they're really being stable, they're stable, I wouldn't be too concerned. However, you have these lymph nodes. I don't know if they look suspicious on ultrasound. You can have lymph nodes that are a little bit enlarged, that are completely benign at this size. You should, if they don't look suspicious, you just monitor on a yearly basis with an ultrasound and see if there's any change. If there are suspicious characteristics like microcalcifications within the thyroid nodule, within the lymph node, then these lymph nodes should be biopsied. Whether surgery is indicated at this size or not, we would determine. It's pretty small. Sometimes you wait when these lymph nodes are so small before jumping back into the operating room. But the short answer to this question is check your thyroglobulin level. If your thyroglobulin level is stable, I wouldn't be too concerned, but I would monitor them on a yearly basis with ultrasound. If there's any suspicious characteristics to the lymph nodes, then I would get the lymph node biopsied. Okay, last question. What is the best protocol for a patient with multiple nodules under 1 centimeter? How often should they be biopsied? Okay, so this happens a lot, right? Because thyroid nodules are very common as we get older. Nodules are, you're more likely to develop thyroid nodules. So nodules, just because you have a thyroid nodule doesn't mean that it needs to be biopsied, okay? So you need to have certain characteristics, like we just talked about with the lymph nodes, certain characteristics of a thyroid nodule to need it to be biopsied. So these things are, does it have irregular borders? Does it have microcalcifications? Does it have increased vascularity? So those are probably the three most suspicious characteristics of thyroid nodules that I would recommend you get a biopsy, even though it's 1 centimeter. Now, I will tell you, there are a lot of places in the country that will not biopsy nodules that are under 1 centimeter. A lot of places will need nodules to be over 1.5 centimeter. So you really need to get to a good endocrinologist or a thyroid expert to get these nodules biopsied. But if they have those suspicious characteristics and they're under 1 centimeter, they should be biopsied. If they're biopsied as benign, then you know that it's benign. The biopsy is reliable at that size. And then you should just get the ultrasound on a yearly basis. If there's no change in the nodule characteristics, then you could monitor them just on a yearly basis. But if there is any change, then you would get a rebiopsy at that time. So, I wouldn't biopsy it every year if it looks the same, but I would be monitoring it every year with an ultrasound. So those were awesome questions, guys. I'm so glad that you submitted them. If there's any questions that I missed, then please leave a comment and I'll address them in my next session. But this is super fun for me to do. I love doing it. I love kind of being in communication with you guys. So if you want to see some of my videos, interesting cases, you can go to my YouTube channel at Goiter Guru on YouTube. If you want to become one of our patients, just contact us at thyroidcancer.com. Have a good day, guys.